Bismillahirrahmanirrahim. Assalamu alaikum. We were doing the development in the developmental disturbances of oral region. We were discussing disturbances in shape, and we had completed dilaceration, disinvaginate, dense invaginatus, dense evaginatus, supernium recusp. Today, the topic which we are going to start is hypercementosis. Hypercementosis. Occasionally, one or more teeth exhibit excessive deposits of cementum on the root. Such deposits are sometimes problematic because the apical portion of the root may have a larger diameter than the coronal portion, resulting in the bulbous or pear-shaped root, as you can see in the diagrams. Teeth with these shapes are difficult to extract without surgically removing significant amounts of surrounding bone. Hypercementosis is more common in teeth that are subjected to either increased occlusal forces or decreased. In both of them, hypercementosis can occur. They are particularly in the teeth of patients with patent disease or hyperpituitarism and on adjacent teeth in areas of chronic inflammation. Where there is chronic inflammation, the adjacent tooth can have hypercementosis. In teeth which are associated with periapical inflammatory lesion, the increased cementum commonly deposits in a band around the apical third of the root. When there is periapical inflammation in an area in a tooth, there the cementum continuously deposits in a form of band, and the root tip of starts to resorb. Some resorption is seen in the root tip. Occasionally, adjacent teeth in an area of chronic inflammation may produce excessive cementum deposits on their roots that eventually fuse at those points, resulting in a concrescence. So, hypercementosis with chronic inflammation, if there's hypercementosis, it can result in the concrescence, which we have discussed previously. Concrescence, which is a union of the roots of two or more normal teeth due to the confluence of their cementum. Because these changes are clinically undetectable, radiographic evaluation is a valuable aid before tooth extraction. Otherwise, it can result in a lot more damage. Now, these other disturbance in the shape is cervical enamel projections. Focal apical extensions of the coronal enamel beyond the normally smooth cervical margin, which is cemento-enamel junction, and onto the root of the tooth are called cervical enamel projections. You can see here cervical enamel projection. These are approximately 1 millimeter wide and 1 to 2 millimeter long and occur primarily on the maxillary and mandible molars. Their clinical significance relates to the fact that they could contribute to periodontal pocket formation. As you can see in the diagram, due to this cervical enamel projection, there will be a pocket formation. Okay, and when there will be pocket, it can progress into periodontal disease. The cervical enamel projection is also thought to play a role in the development of paradental cyst, also referred to as buccal bifurcation cyst or Craig cyst. Cervical enamel projections differ from the ectopic droplets of enamel that primarily occur in the bifurcation or trifurcation areas on the roots of molars. So, what are the ectopic droplets on the enamel in the bifurcation or trifurcation area on the roots of molar? They are enamel pearls. We'll discuss them. So, these are cervical enamel projections, and they can play a role in the development of periodontal cyst. Paradental cyst is a cyst of odontogenic origin, commonly located subgingivally on the buccal aspect of an erupted mandibular molar, bifurcation cyst, or the distal surface of a partially erupted mandibular third molar. So it is odontogenic origin है. It is located subgingivally buccal aspect of an mandibular molar or the distal surface of a partially accepted mandibular third molar. Okay, it can be in these areas. Here you can see it is a mandibular molar, first molar, and it is near to the bifurcation area. Now, what are enamel pearls? Enamel pearls are very uncommon. They are basically the enamel projections, cervical enamel projections, like atopic droplets type है, that primarily occur in the bifurcation, ये जो bifurcation वाला area होता है, or trifurcation area of the roots of the molars. They are called enamel pearls, or they are also called enamelomas. Enamel pearls are very uncommon. They can be radiographically seen as 1 to 3 millimeter round radio opacities. In the form of radio opacities, you can see this is an extracted tooth, and this rounded thing in the droplet in the bifurcation area is the enamel pearl. Histologically, enamel pearls may be composed largely of enamel, or they may exhibit a little central core of dentine. Treatment is not recommended because if you will treat it, it often leads to development of root caries, or external resorption occurs, and pulpitis starts to occur, and eventually it will lead to root canal, and it can also lead to loss of tooth. So they are of no harm. They can be kept as they are. Here we will finish the disturbances in the shape, and next topic will be disturbances in structure of enamel. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.